Greetings to one and all present here. I'm Hasna Arshia, Ph.D. Research Scholar from the Department of Home Science, Women's Christian College, Chennai, India. So I'm here to present my study, a study on the socio-demographic profile and lifestyle of women with multiple sclerosis in Chennai, South India. Coming to the background, multiple sclerosis, also known as MS, is an autoimmune demyelinating and inflammatory disorder of the central nervous system. So within the CNS, the immune system attacks myelin, which is a fatty substance that surrounds and insulates the nerve fibers. The damaged myelin forms scar tissues, which are known as sclerosis. So when the myelin sheath is damaged, the nerve impulses that travel to and fro from the brain and spinal cord are disrupted, producing a wide variety of symptoms. Now, the disease strikes a young and dynamic population at the age group of 20 to 50 years, and women are twice affected more than men. The disease is also termed as crippler of the young adults. So, more studies on MS are required in the Indian context, and nutritional status, lifestyle, socio-demographic profile of MS patients have not been extensively studied or reported in India. So I think there was a need to study the profile and the lifestyle of women with multiple sclerosis, which could actually help in improving their quality of life and also reducing their further disease progression. Now, significance and objective. More focus is given to chronic diseases like diabetes, CVD, and cancer, but a chronic disease like MS is usually overlooked just because of the fact that there are not enough studies or awareness on that. And MS is a disease which strikes early in life and places heavy demands on the person and their family, physically, emotionally, mentally, and financially. So it was once a rare disease in India, but studies throughout a period of time have shown an increase in people with MS. So main objective of the study was to study the demographic profile, social demographic profile and lifestyle of women affected with multiple sclerosis. Methodology, study design. Study falls under descriptive research design as a qualitative study. Sample, 30 female subjects diagnosed with multiple sclerosis and registered with Multiple Sclerosis Society of India, Chennai chapter, were included. Sampling criteria, we have the inclusion criteria. Women aged 18 to 50 years diagnosed with MS and people who were willing to follow the study protocol were included. Exclusion, subjects who were severely disabled, that is the EDSS above 7 excluded. EDSS is nothing but the disability score of the patients. So patients who had disability score above 7 were excluded and pregnant women were excluded from the study. Next, we have the tools used. We have the anthropometric assessment, which includes height that was measured using a stadiometer. We have the body weight that was measured using a portable weighing scale. BMI that was calculated using the formula body weight in kg by height in meter square. An interview schedule was used to collect general information on the socio-demographic profile and lifestyle pattern of the participants. A food frequency questionnaire was also used to calculate the frequency of consumption of foods. So these are the different statistical tests that were done, and the data analysis was performed using the SPSS package 21. Coming to results and discussion. Mean age of the participants was 34.5 years. Looking at the educational qualification, majority of the participants were graduates and postgraduates. All the 30 participants were involved in sedentary activities as they were housewives or working as computer personnel. Now, most of participants could not pursue their education or career and they were homebound due to the burden of their chronic debilitating condition. And patients who had a mild score, that is the mild disability score, they were able to manage their occupation, but patients who had a severe score were not able to pursue their career because it was difficult for them to manage their activities due to the symptoms of the disease. Coming to the income classification that was given by HUTCO, the majority of them, that is 53.3%, belong to high income group. Now, income is also very important when we plan an intervention program for the patients because economic burden of MS is more and it includes the cost of diagnostics, intervention, monitoring, and loss of patient productivity and employment. Majority of the participants belong to nuclear families, and type of family plays a major role because it can have an effect on the meal preparation and nutritional status of the entire family. So all this has to be looked into when you plan a counseling session or an intervention program for these patients. Next comes the marital status. Majority of them were married according to this study, and since MS is a disease which affects young adults, it can have an impact on the relationship of the individuals as well. So there are adjustment issues, and coping with symptoms of MS is not only challenging for the person affected with the disease, but also for their spouse. So women diagnosed with, according to studies, women diagnosed with MS face a six-fold increase in the risk of divorce. So relationship distress may lead to a poorer course of illness if it's not addressed adequately. Now, coming to the lifestyle pattern, when we look into the body mass index, which is the BMI of the participants, it was 27.1 kg per meter square, which shows that majority of them fall under pre-obese category according to the World Health Organization BMI classification for Asians. Obesity is a risk factor for MS, and overweight and obese patients, they have reported a lower mental and physical health and also poor quality of life. So according to studies, those who were overweight or obese also had worse health outcomes. Now, this is a graph which shows the BMI classification of the participants. Now, physical activity. 10% were engaged in brisk walking, 6.6% did meditation, and 3.3% did Zumba. So 80% did not engage in any kind of physical activity, which means majority of them were physically inactive. And subjects who had gait problems, vision problems, they did meditation and relaxation exercises to relieve stress. But a higher percentage did not engage in any kind of activity, but exercise has been shown a lot of benefits in MS. So subjects need to be encouraged, and awareness should be created on the benefits of regular physical activity among these participants. Next, coming to stress levels, majority of them had moderate stress. So most of the MS patients has had stress because of the burden of the disease, their treatment, pain, depression, managing family life, work, and financial issues. So stress could trigger MS symptoms, and it should be avoided for efficient management of the disease. Coming to sleep and dominant dietary pattern, majority of the subjects had problem falling asleep, and they had complaints like insomnia. But whereas 40% had refreshing and sound sleep. Now this could be again due to the symptoms of MS, which can be symptoms of MS like pain, fatigue, walking difficulties, bladder and bowel problems, etc. Now looking at the dominant dietary pattern, we can see that majority of them, that is 77%, were non-vegetarians. So I think counseling was required, and awareness and nutrition education program was required in these subjects to opt for healthier versions like lean meat, fruits and vegetables, and red meat and saturated fat. Now coming to the food frequency pattern, majority of the subjects consumed rice every day because rice was a staple cereal in South India. Now fruits and vegetables intake was lower in the subjects, saturated fat intake was higher, and most of them adopted for economically feasible and foods that were convenient and readily available. So according to studies again, animal fat has a very deleterious effect on MS, whereas consumption of fish, which is a good source of vitamin D and omega-3, is known to have a protective effect on MS. So nutrition education and awareness is required. Fruits and vegetables, which are a good source of antioxidants, have to be included because studies have shown that antioxidant therapy is known to have a beneficial effect for MS. Research studies have also indicated that MS patients who consumed a healthier diet, which included a diet rich in fruits, vegetables, legumes, whole grains, and lower in added sugar and red meat, and people who had a healthier lifestyle, they were actually less likely to have depression, pain, fatigue, when compared to people who had an unhealthy lifestyle. So promoting a healthier lifestyle has become a need, a dire need for people affected with multiple sclerosis. So summary and conclusion. Results of the study have significantly brought to light the socio-demographic profile and lifestyle in people with multiple sclerosis and the need of the hour for a dietary intervention program in the younger generation who are affected with this crippling disease. So according to this study, majority had a sedentary lifestyle, malnutrition, less knowledge in diet and multiple sclerosis, and then they had, less nutrition on multiple sclerosis and lower physical activity levels. Hence, dietary intervention program needs to be planned. This is the bibliography of the study. Thank you all for your attention.